It's a really exciting time for migraine. So this past year, the CGRP monoclonal antibodies have been approved for the treatment of both episodic and chronic migraine. It's the first time migraine therapy that is specific for migraines actually been developed and approved since the 1950s or 60s, so it's been a long time coming. The results we're seeing from these monoclonal antibodies are quite significant, with greater than 50% reduction in migraine headache days in more than 50% of people. Some of the studies have been great too, because they've shown some group of patients that have had a greater than 75% response rate, and a few studies that have even shown 100% in some individuals. So these therapies have really been life-changing, and that's what I've been seeing in my clinical practice. So it's nice at the AN meeting to actually see some of the additional long-term studies that have been going on with these medications. A lot of the studies that have been out and the posters that I've reviewed have shown definite benefit, both in not only reducing migraine headache days, but also improving quality of life. I even saw one poster demonstrating helping patients' depression, which would make sense with such a disabling condition. Migraine is actually the second leading neurologic disorder for years lived with disability, so it has a huge impact on patients. It affects about 31 million migraineurs in the United States alone, and about 1 in 7 people worldwide, so it definitely has a huge impact on people. So being able to present these medications to them as an alternative for the traditional standard preventative therapy is really nice. Also, some of these other standard preventative therapies have had side effects or can't be used in certain patient populations. And what's nice is these new treatments have allowed us to use it in patients that have other significant comorbid diseases. Some of the studies that have been out, that I've been looking at some of the posters, have demonstrated no significant effect on cardiovascular issues. So that's always been one limitation in some of the acute therapies that we use for migraine, the triptans, which have limited the patient population. So we're seeing good effect. These medications have just come out, so patients are wondering, are they safe and effective to use? We know from other biologics that are similar that there's maybe some concerns for safety, but in long-term studies with some of these CGRPs, the companies have been great at really demonstrating no increased safety risk with certain things, cardiovascular being on the top of the list. Definitely more expensive when you compare to other preventative therapies out there that are oral tablet that you can take. These are all injectable that are currently on the market. There may be some that come out in oral tablets in the future that are in development. They run about $7,000 for the year, so not an insignificant cost. However, many of the companies have assistance programs right now, savings cards, so that's reduced the cost. Some of my patients actually pay nothing for the year. Some patients may pay a couple $100s a month, so there's some variability. But we're starting to see that insurance companies, if patients have failed 2 standard preventative therapies or with chronic migraine on a botulinum toxin, that they are readily approving these medications for patients. So I've actually been very impressed at how much the insurance companies are allowing patients to start these medications. I think given the fact that they see the huge disability, they also use a huge cost of going to emergency room, physician visits, testing. They overuse some of the triptan medications, so there's a high cost with that. So I'm hoping that we'll see that the actual cost of these medications is overridden by actually patients saving by not going to the emergency room. And I've seen that in my clinical practice as well, where some patients once a month or every couple months would go to the emergency room. Now they're saying, I'm not getting those severe headaches anymore. Might still get headaches, but they're more easily treated. They're more in the mild to moderate range and certainly not disabling.